What's your blood pressure this morning? Anybody check it? How often do you check your blood pressure? Good morning, Suburban Prepper. I want to talk about hypertension, high blood pressure. All too often, I see my patients and I preach like a Southern Baptist preacher. Cut the salt out. Increase the water intake. Go for a fucking walk. Cut out the alcohol. Cut back on the Coke. Hell, cut out the Coke. Stop drinking soda. Stop drinking juice. First of all, stop juicing and making yourself think it's healthy. That's a big ass scam. And then the elephant in the room, or the donkey in the room in this case for most of my patients. Why aren't you taking your blood pressure medicine? Do you want to get a stroke? Because that's what's going to happen. Hi, I'm Suburban Prepper. You hadn't figured it out. I work in healthcare. I'm a nurse practitioner. One of the most preventable actions that you can take is to monitor your blood pressure and to incorporate these simple activities that would lower your blood pressure. Okay. First of all, I want to go over what blood pressure really is. Okay. What blood pressure means. You know, you go to your doctor's office, or in my case, I'm the nurse practitioner. The nurse sometimes, you get your blood pressure taken. You get these two numbers, right? A big number and a lower number. And now this is where I want you to open up your mind, folks, and think of your heart and the veins and the arteries pumping through your body as a pumping system, a pumping mechanism. Okay, so that top number, the systolic of your blood pressure, systolic. Okay, that's when your heart's pumping. That's the pressure in the valves everywhere when it's pumping, in the arteries, I should say. The diastolic is when the heart's contractions relaxed. So there's two different pressures in your pumping system. One when it's being pumped, and one when there's a phase of no pumping, basically. And of course, what are you pumping? Oxygenated blood to the body. To feed the body, to feed your body. That's what blood pressure is. What's a good blood pressure? Optimally. Okay. Less than 120 over 80. Now we're talking about high blood pressure today. Low blood pressure is a whole different ball game. We'll get into that different discussion, okay? What are the complications about having high blood pressure? It's cumulative, folks. So for my population, the immediate threat is having a stroke. The next complication is developing congestive heart failure. More down the line, kidney failure. Different body organs. Let's take the fourth. The fourth is retinopathy in your eyes. The ones are down. All the pressure. So you have a stroke, which is basically a bleed or a clot somewhere in your brain. And in the case with high blood pressure, it's usually a combination of a clot or a bleed in your brain. Let's talk about the heart. Well, heart failure is when your heart quits pumping effectively. Congestive heart failure. The heart gets so big that there's no more room for it to pump effectively. Or the heart doesn't pump effectively because of the high blood pressure. Okay. The eyes get damaged because of the high blood pressure, the high tension in the eyes. And this is the one that we look at more so. It's the kidney damage that happens in high blood pressure. The kidneys, you could no longer are able to process the protein that goes through your body when the blood pressures are so high, and the constriction to the kidneys damages them, where they quit working as a filter. And guess what, folks? After a while, you end up on dialysis or you die. And then I have people tell me, well, I don't want to take pills for blood pressure. Okay, great. So you have to monitor your blood pressure naturally. The biggest thing you can do is don't put things in your body that raise up your blood pressure so high. Now, I hate to say it because I drink coffee now. I have to. Coffee is a vasoconstrictor, raises up the blood pressure because of the caffeine. 1 cup a day is fine. 2 cups a day is fine. Salt. Think of salt as when something's salty in your body doesn't like it being so salty, so it adds more water to it. And when you add more water to it, that's more volume. When there's more volume, hear me out on this, the pump has to pump harder. More volume, harder pump. And as a naturopathic, I look at the inflammatory state of a body, okay, as a reason why someone's blood pressure is high. Stress levels, cortisol levels. Now, the naturopathics I'll discuss later. Right now, we're just focusing on the medical aspects. The stuff that I prescribe to a patient that they're supposed to take. So what can we do, folks? Salt, cut the salt out. I'm going to tell you this, folks, it's somewhat controversial. Don't eat oil seeds. Don't put oil seeds in any oil that comes in a seed from a seed, don't eat it. Okay, it's the same thing as drinking juice from a fruit. Don't drink it. Eat the fruit, eat the seed. Get all the health benefits from that. Quit adding so much salt and sugar to your diet. Yeah, you need some salt in your diet, okay? Your body doesn't produce salt by itself. And yeah, a lot of your foods have salt in them already. Another natural way to manage your blood pressure is the processed foods, folks. If a food comes in a package that's sealed, a cardboard box that's sealed with a seal in it, sealed for freshness, and you see all these ingredients, and it's got all these artificial colors and preservatives, just the toxins that it's putting in your body. That's why you want to, as a prepper, and as a survivalist, if you watch my channel, you know this. That's why you want to have your own garden, harvest your own vegetables. Try to, anyway. And that way you don't have to use all these chemicals to make your food last longer. And two, buy a freeze dryer. Freeze dry some fresh food, save it when you need it, and reconstitute it, and it's delicious. Anyway, back to high blood pressure. All too often, in my career, I've probably had 20 patients that have ended up on dialysis through their life. And the sad thing is, some of them are so nonchalant about it that it's not a big deal. And they think that they're just going to get a kidney from someone, kidney transplant. And it's just so easy to happen. And then it's an after the fact thing, folks. I tell these patients, you're at risk for having a stroke. You're at risk for heart failure. Exercise, okay? Working out, exercise relieves stress hormones in your body, secretes the endorphins, lets your heart pump effectively. That's cardiovascular and lifting exercises. Okay, stretching, meditation, do it all. And do balance. We don't work our nervous system enough. We need to do balancing exercises to work our nervous system, to keep us aligned. There we go. Well, let's talk about medicine now, okay? The first line medicine that I like to prescribe for blood pressure are angiotensin converting enzymes or angiotensin reuptake blocker, ARBs, like lisinopril or losartan. And basically, these medications work with your kidneys to block angiotensin, which is a vasoconstrictor. So it basically protects the kidneys, lowering the blood pressure. And then people have side effects. Okay, let's go over the side effects. Side effects of taking like lisinopril, the most common side effect is this ACE cough that people develop. Okay. The other side effect that I've seen is angioedema, swelling of the lips and the throat. That's pretty dangerous. Most people don't develop it. Maybe 1% of the population has it. Now, these pills don't do you any good unless you take them on a daily basis. They were meant to be taken once a day, not every other day. The next medication are diuretics, okay? These are the medications that help you excrete urine, help you excrete that volume. Now, I should add that, okay, if you're getting rid of water, things follow water. So there are basically, there's several types. There's some water pills that when you go pee, you lose potassium. And for some people, that's not a problem. There's some people that you go pee and you want to take the water pill that helps you retain the potassium. It doesn't make you excrete potassium. Basically, Lasix or hydrochlorothiazide more so with hydrochlorothiazide or chlorothalidone, you're going to lose some potassium. Spirolactone, it spares potassium in your bloodstream. And two, when you lose that water, that can damage your kidneys. You're trying to protect lower your blood pressure, but too much of a diuretic because of the volume depletion can damage the kidneys. And what people often do, and they do this incorrectly, is they'll start cutting back on their water intake, thinking that's healthy because they're trying to pee out the water anyway. No, you still need the stream of fresh water to come in to filter everything out. You just don't want to get overloaded to filter it out. So yeah, folks, you still drink water. Okay? Okay, well, I'm just letting that sink in for a minute. So we talked about ACE inhibitors, ARBs, diuretics, or water pills. The next line of therapy is calcium channel blockers. Now, these are basically vasodilators, okay? They open up the vessels and decrease the pressure. So if you open up a vessel and it's not so tight, the pressure decreases. And so the blood pressure is less, and that's a little bit less damage to the body. And sadly, the side effect of calcium channel blockers like amlodipine or nifedipine are lower extremity edema. Because of that vasodilation, okay, you start getting swelling, the fluid goes down to your legs and they swell up. All right. Now, it doesn't occur as often with the newer calcium channel blockers, but it can still happen. So let that sink in for a minute. So all these pills that you take, we've had some side effects we have to watch out for. Okay. We back up a little bit. Go back to the ACE and ARB inhibitors. Initially, you're going to have what seems like some kidney damage from taking these medications. The creatinine level, the BUN, and the GFR will decrease. But eventually, after a couple months, it will go back to normal for what your normal was. Another line therapy are, and I don't like prescribing beta blockers for hypertension because they were meant to be prescribed for heart rate. It blocks the rhythm of the heart from beating too fast. But it does have and help lower the pressure some. Beta blockers. Okay, that's more of a heart pill. And it has its place. Now, some off-label uses are like anti-anginal medications because of the massive dilation effect. It opens up the blood vessels and the blood pressure drops. Long-acting nitro, not the nitroglycerin patches. I mean, they're meant for chest pain or angina, Okay, when the constriction of the heart, real bad cases of coronary artery disease, but they also lower the blood pressure. And then I got to add my adjunct. And I won't add any more adjuncts. We'll just stick with those therapies first. So the labs that I like to look at, the labs that I look at when I'm dealing with high blood pressure, okay, are the kidney labs predominantly. The kidney labs and the urine labs. And so I look at the creatinine level. I look at the BUN, urea nitrate level. I look at the glomerular filtration rate. The GFR is basically how much urine you're making in an hour. And the byproduct of protein is urea nitrogen and the creatine level. If there's more damage, those levels will go up and the GFR level will go down. Obviously, I talked about potassium. Check potassium levels. You want to also look at magnesium because magnesium follows potassium. And you want to check iron levels and a blood count. And the urine. You want to look at urine. You want to get a urinalysis, look at the urine. And you want to look at the albumin in the urine, okay? That's the indicator. That's the big indicator. I can't stand it when I order labs and a urine test and a patient thinks I'm ordering a urine drug test for some reason. Like, I don't order something unless I have to. Believe me, I have enough lab results I have to look at. And they won't do the urine test. Kind of some false paranoia. So there we have it, folks. Hypertension. And if you want, I'll just jump into the naturopathics. And I'm going to jump into the top 3 that I think would be beneficial for you as preppers and survivalists in conjunction with the prescribed meds and the diet modifications. Now, here's the thing, folks. A lot of providers don't put any weight into naturopathics. And the truth is, a lot of people think if they take a pill, they don't have to change their diet. It doesn't work that way for anything. You've got to improve your diet. But let's just jump into what I think are the best naturopathics for blood pressure. Start with number 1, go up to number 3, okay? Beet root. Beet root. It's a vasodilator. You've seen the commercials for beets on the television, YouTube, and all that. You've probably seen them. Beetroot comes in a capsule. Take it. It's good for blood pressure. Okay? But here's the thing, folks. Don't just take a pill and not look at your blood pressure. You have to monitor to see if this medicine is actually working. You have to be proactive when it comes to your health. Because you're not going to be able to go see a doctor every day when you take a blood pressure. Contrary to what some patients may think, that we're not at your beck and call to just come into the clinic and get your blood pressure taken and expect an immediate response from you. I can't do it. The next son of a bitch just going to walk out and get hit. Come on, man, be better than that. Anyway, Dude was just walking in the middle of the road. Didn't even look at me. Good thing I keep my peripherals on. Hawthorn berry, folks. Hawthorn berry. I've done a YouTube video on blood pressure, heart disease. Hell, that nobody's watched because I just don't know how to make videos that sell, but whatever. Hawthorn berry is great for blood pressure. Next to beetroot. Okay, folks, Hawthorn berry. Now, if you watch my video, and maybe I'll put a link to it in this description when I get home this evening. But, or maybe I'll do a separate video on these three. It's probably a better idea. Now, the third medication or naturopathic is garlic. The active ingredient in garlic, I believe, is allicin, and that helps lower the blood pressure. So I just want that to sink in for a minute, folks. Now, I tell you, patients, to take these in a pill form or capsule form, okay? Because I can't grow garlic in my backyard prepper garden to save my life. I can grow beetroot. That's pretty easy to grow, but I don't like beets. Okay, I hate beets, and to me, I have such limited space in my prepper garden that I just buy the beetroot in a capsule. And I couldn't even tell you how to grow hawthorn berry. It's a tropical fruit, okay, and it needs to be grown where it's tropical. And if you are from the 48 states or Alaska, unless you live down in Florida or wherever, you're not growing tropical fruit unless you have a way of growing it indoors. And if that's the case, you're probably not listening to this channel if you have that big of a greenhouse already. So, those are my three naturopathics for hypertension. Yeah, folks, hypertension. All right, let's just put some realistic parameters, okay? Now, if I have some 80, 90-year-old patients whose blood pressure is in the 150s, and these patients, they go to see other doctors for their chronic needs, and then I get a report back about this guy's blood pressure is too high. If you're 90 years old and your blood pressure is 150, guess what, folks? I'm not doing a damn thing about it. That's the last thing I need to do is let your blood pressure get too low. God help you if you're still walking around, that's great. And then you walk around, your blood pressure is too low, you fall, you break your hip, and you die. Don't want that to happen, folks. Also, I need to add one more medication, natural medicine or not. Some folks should take a baby aspirin to help with circulation. If your platelets are too high, they get too sticky. So that's the thing, folks. What did I talk about first? I talked about the platelets. If your platelets are too low, you shouldn't take an aspirin. Okay, that's hypertension. A drive-by hypertension discussion. I got good news, folks. I got good news. I'm going to be doing videos, live videos, using my Halo thermal scope. I have the attachment now for my phone that I can record the phone. Excuse me. Connect it to my Halo, and you'll get to talk with me and watch me through a $7,000 thermal scope, looking through the camera. And that's actually a pretty good deal, folks. Alternatively, I want to do using my IR laser, my my PVS 14, and using my clip-on thermal imager or my TAC, and aiming that laser at different objects at night, of course, because it's a night vision show, and let you see how it works. Now, the only downfall is I'm not going to actually be pulling the trigger because I'm going to be doing this in my backyard, and I don't want the cops to get called again to my house. Okay. So I have the stand for it. I have a mount that I don't have to actually put a rifle on it. I can put the IR on the mount. It's basically a rail for an upper that I never used, but I can attach stuff to it. And that way I'm not aiming a weapon at anybody and getting in trouble for that. And I can attach my the device itself to the rail and attach the rail to my tripod and just put it in my backyard and have a good time. Just like Fred and Barney, if you know what I'm saying. It's going to work, folks. It's going to work. I wanted to go shooting this weekend, but I got inspired. I got so inspired. I was at the hospital, and I was talking with a nuclear medicine nurse. And of course, I talk about prepping, okay? I mean, I'm not trying to like recruit people or anything because it's not what I do. And it inspired me. Okay, why don't I make a video about women's health issues related to prepping? And I am a women's health provider as a nurse practitioner. I did the training. I know the medications, and I know the natural pathic herbals to take as well. So I did 5 videos I made that I'm releasing over the next few weeks about women's health and prepping and survivalism. And this is coming from me, folks, a medical provider who's a prepper, who's a combat veteran. Quick story, I may remember, in my all-male unit that I was in initially, during the war, we worked with other units that had women. And so we had to address some of the health issues that some of these women faced. But even as a teenager medic, when I was wet behind the ears, it opened up my eyes to what a UTI was, to what BV was, and to what Candida was. And we didn't do any STD testing or look under a microscope. But I learned to differentiate between the three early on. That didn't make me a women's health provider. It opened up my eyes to issues that some men face versus what the ladies face is different. So I wanted to apply this in my videos across the spectrum. When I say spectrum, the young women to the older women, and the health conditions, the life conditions that women face that we men don't think about. Now, some people are going to say, well, you're not a female. What right do you have to make these videos? I could talk about leukemia or lymphoma, okay, all day, and I don't have a blood disorder, okay? I'm never going to grow a vagina. I'm never going to have ovaries. My breasts are never going to secrete milk, but I can still talk about those processes. I studied them as a healthcare professional, and that I'm board certified. So yeah, folks, I can talk about it. I can't have an opinion. It's not a gender thing. It's a human thing. Okay, folks. Now, I'm sure that there's this is geared towards more the men and the women that have to deal with issues that our female preppers have to deal with. And it's good to acknowledge these issues. I want that to sink in for a minute, though, folks. Now, do you have a prepper group? And do you have the ladies in your prepper group? And have you thought about, or maybe they should think about, because it takes your own initiative. Because I talk about the naturopathics in the videos for different conditions. It's not about telling you how to treat something. Okay? I don't want to do that. I don't want to get in trouble. I'm not diagnosing you or anything. This is just some broad advice. I shouldn't have used the word broad. General advice about specific conditions. Everybody's health issues are different. Okay, I said it. I said it. So these videos are going to release. They were a lot of fun to make. And it was a good review on the naturopathics of some of these things. And it's not a disease, okay? It's just some processes that women deal with that men don't have to think about. So I did it, folks. I made and released a new night vision and thermal video. And it's on my YouTube channel right now. Okay. All the footage that I've taken from my night vision using my cameras, I consolidated them into a nice package where I discuss the FLIR breach, which is a handheld monocular thermal. I discussed the PVS 14, which, if you haven't known by now, it's a third generation night vision device. And I discussed what I call a CODI, or a TAC, a clip-on thermal imager that you attach to the PVS 14, and the benefits of each. Now, so in the video, I have my nice little introduction, which is a little bit lengthy because I like to hear myself talk. And then I get right into it. The only thing I did wrong in the video is I'm talking about the devices in general. On the bottom part of the screen, on the top part of the screen, I have the different imaging recordings. And I do have a subtitle to tell you what's being shown. Basically three things: a PVS 14, the FLIR breach, or PVS 14 with a clip-on thermal imager. So it's my talking points do not reflect what's being shown in the image directly. But you guys are smart, you know. And I'm going to make my videos. I'm taking out my FLIR PTS 233 and my Envision Halo LR out to the gun range and get them zeroed. Okay, folks. And now that I have that attachment, I can actually get my phone to zoom in using a weapon-mounted tripod on a weapon-mounted tripod with a nice scope, which I have, to actually see the targets better, instead of using the digital zoom on my phone and having to use the zooming apparatus on the camera when I fix the video or, do the edit. So what's more natural, folks, is you let the optics do their work, and you're going to hear everything because I'm going to be using this camera that I'm making a live with. And of course, I have my Sony camera that I can do recordings with. So it's going to make for an exciting video because you're going to see where the shots are being placed. You're going to hear where they're placed. And you're going to see what I'm aiming for and what I hit and how do I adjust for that. And that's what we're going to do, folks. Well, that's what we're going to do. It's going to be awesome. Oh. All right. Does anybody have any questions? Are there any? I need you to comment on YouTube, okay? I know this is on Facebook and Rumble, but go on my YouTube channel. If you have any questions or any ideas about any prepping content that you would like to see, let me know. I come up with ideas related to suburban prepping, urban prepping, and I do a little rural, but I'm not a rural person. I live my truth, okay? I want you all to have a good day. So today's Monday, okay? And I used to get to work from home on Mondays. But ever since Trump signed that law or that executive order that we all have to go back into the clinic, I have to be at work on Mondays, and my body is still not used to it. And I know you're going to say, well, you're pretty pathetic, suburban prepper. Everybody else has to drive to work. I can assure you, folks, that the day I would work from home on computer doing telephone visits, I kept proper busy. There was no flim-flamming around. It was a lot of work. And now I drive into work, and it's still a lot of work. I'm doing the same thing. But my boss, because we have a new boss now, she's changing the schedule where I won't be doing telephone and visits on one day and just have that locked for those visits. They're going to change that, where I'm going to be doing throughout the day. Oh yeah, one more thing I got to just throw at you, okay? One more thing before I go. Airsoft. And using airsoft for small unit tactics to train. If you have a mutual assistance group, and for small unit training. Has anyone ever done any airsoft for with your fellow preppers just to practice with your gear? Because here's the thing, folks. Minus the real bullets, you can bring your gear to an airsoft event, okay? As long as nobody gets hurt. or that gear is not used to harm anyone, and you can bring it with you, and to see how the rigors of running around, doing offensive and defensive operations using your gear. Now, the skeptic in me is, well, I'm not going to bring a $5,000 thermal or $4,000 PVS 14 to an airsoft event so just someone can just shoot through it. I agree. That's where digital night vision would come in. And the great thing about that digital night vision is that you can wear it during the day. It's basically an IR camera, and you need that IR light. So you'll still be able to use it during the day and at night. I'm not a big fan of digital cameras or digital scopes or digital night vision. I think it's a flaw. But now I'm changing my mind. I changed my mind about airsoft. I thought this is horrible because these guys are not going to learn tactics. But let's say you get someone in there that knows small unit tactics, okay? And I'm going to be honest with you. It's got to be a Marine or a paratrooper or an Army guy, an infantry guy in the Army. Someone that's a combat arm infantry fella that knows these small unit tactics that can train. Because you learn how to do something the wrong way, you're going to practice it doing the wrong way. I'm thinking about it, folks. Now you're going to say, well, airsoft is not, it's not simulating. Well, when we would go to JRTC at Fort Polk or jump into JRTC or drive in, a couple times I've been there, what are you doing, folks? You're basically doing small unit tactics. A lot of time it's just patrolling and being, just getting exhausted. You're doing the same thing with airsoft, except it's in a more controlled environment and there's a time limit. And you don't practice any of the logistics that a unit has to practice, like resupply and stuff. It's a couple hours, you're going to do some specific things and have some fun doing it. And guess what, folks? It's exercise. You're moving your body. Isn't that great? Get on my YouTube channel. Leave me a comment about any other medical issues that you'd like me to discuss. I don't give out free medical advice specifically. Any prepper videos, prepper related content, or any comments. I respond to all my comments, even the ones that are offensive, because I learn from them. Now, there's some people that'll just say something stupid. Okay, I get it. And sometimes my earlier videos that I've made, and some of them are horrible, I get it. I don't take it personally. I look at some of my older videos from when I started doing videos, and God, I cringe. But here's the great thing, folks. There's some good parts of those videos that I can take back to the cyber power and re-edit those videos and take out the crappy parts and leave in the good parts. Because I mean, it's just how I present my videos. Sometimes early on, I did it horribly, and I used a horrible title and I used a horrible thumbnail on YouTube, and I'm like, this thing sucks. So yeah, I cringed too. And so it's a learning process. I mean, this is an art, and I enjoy prepping. I enjoy survivalism. I enjoy making YouTube videos. I enjoy healthcare, guns, politics, and I like to do freeze dry videos. In fact, I'm working on doing a freeze dry video. The parts where I got my freeze dry done, I packaged it all up, and the next part I'm just going to let it sit for a few days. It's in its Mylar bag. I'm going to open it up, and reconstitute it. I freeze-dried some hamburger, little piece of steak, and some grilled chicken. You're going to enjoy that video, folks. All right, have a good day. Suburban Prepper out. God bless everyone, all of us.